There are more than 650 supplements, pills, capsule things that are marketed saying that will decrease the risk of dementia. Unfortunately, when studies are done, all a waste and mostly money-making things. The only thing that has been found to be helpful in studies is omega-3 fatty acids, and that you get from salmon, and that you get from um, nuts, particularly walnuts. The one you get in Costco, those little capsules of omega-3, unfortunately, no. You want the natural one. That's why I'm emphasizing the need to eat salmon and nuts, olive oil.
Not provision. Not provision.
Is there a limit to how many nuts we can have in a day? Like,
Everything has to be in moderation. I don't think anybody's done a study. Everything has to be in moderation.
Then what about the other fishes other than salmon?
Other fishes have omega-3, but not the highest concentration is in salmon.
Salmon, okay.
And again, you want to get as fresh as possible. You know, lately I've seen it in the cans and stuff. Okay, best is the fresh one.
Thank you.
What about brown sugar?
Brown sugar, if it's not in excess, but sugars in general are not good.
The white sugar
Brown sugar is better,
better is
yes,
brown. Yes.
but any sugars in general, I know आप मीठा पसंद करते हैं.
so ये brain के लिए क्या? वो आप खाओगे नहीं?
So, you know, haldi khana is good for some kind of inflammation stuff, but when studies are done for the brain, unfortunately, it hasn't been found. But despite that, I still take once every other day a pill. So,
Haldi
Milk.
in milk is good.
however you like to do it.
Both combined.
The World Health Organization and other organizations have also said multivitamins, if you're having a healthy diet, balanced diet, you get enough vitamins from that. If you're having an unhealthy diet, where esoteric, strange kind of diet, where there you may not be getting vitamins, their vitamins may be necessary. But in general, in this population, where you get a balanced diet, you don't, extra multivitamins really haven't been found to be beneficial. And Cochrane Reviews is an organization which groups together all the studies, so it increases the power of the study. Individual studies may have 1,000 subjects, and that is not a powerful study. You need thousands of people to see whether it really makes a difference. So to increase the power of the study, Cochrane Reviews combines the studies to see the result is beneficial or not. And when they did the analysis, that they said at the moment it is not possible to identify any supplements which can reduce the risk of dementia. And sometimes higher. So the more exercise you do, the lesser the risk.
How you describe myths?
Say that again.
Myths.
Myths. There's a formula which measures your oxygen consumption when you're at rest, and when you're exercising, it measures it. So it's a formula to calculate it. And pardon me.
Who calculate the formula?
Who calculates the formula?
Like, how do we get it? I think. How do we find out?
I will share. I have in the notes. I will share that with you. The formula. Yeah.
Okay, thank you very much. You can charge it.
But a simple way to know how much exercise you can do, how good you are, I will show you later. I have a picture. What are the benefits of exercise? Numerous benefits, but the important ones are it releases brain developmental factors which called BDNF, brain neurodevelopmental factors, which stimulate the production of synapses. So it develops, releases certain substances, hormones, which promotes the development of the synapses, which are critical for brain function. It releases endorphins. These are called kind of hormones which are good for the brain. These are called feel-good hormones. Endorphins, dopamine, serotonin, oxytocin. They are feel-good hormones. When you exercise, after a certain amount of exercise, when these are released, you feel like running forever. You feel so good. And that's why after a certain amount of exercising, it becomes addictive because you want those endorphins to be released, makes you feel good. What it does is more important than that is it opens up the vasculature, the blood supply in the brain, which is critical for nourishing the brain tissue. So it releases the endorphins. Of course, there's more blood flow, oxygen to the brain, which is critical. And it has been shown consistent exercise improves your IQ, your cognitive abilities, and so on, and thus decreasing the risk of dementia. So I cannot emphasize enough how critical it is to do exercise, and the recommendation is a minimum of 30 minutes every other day, walking. If you're more aggressive, jogging maybe 3 times even. If you can't do that, go around the block. In the winter, go to the mall and just make one circle. Important thing is 3-4 times a week, get at least half an hour, as much as you can do it. Okay, not only for your brain, for your heart, for your muscles, for everything. Exercise, I think, is the most important thing you can do for your health. A simple way of assessing your physical fitness is doing the one leg stand. Don't do it freestanding. Make sure there's a chair in front of you. We don't want you to fall. And the amount of time you should be able to do that, 50 to 59 years of age, for about a half a minute, you should be able to stand. By the time you get to be 80s, 70 to 80, about 15 seconds. The more physically fit you are, the longer you will be able to stand on one foot. So keep assessing this, doing this every month or so, see what your fitness level is, not only for the brain, and we'll talk about fall prevention later on, how important it is to remain fit. We talked about those things, but lastly, we want to make sure you keep challenging your brain. All the stuff we have learned all our ages, we know the brain is not making new synapses, connections. To make new ones, you have to do new things, stimulate your brain. How can we do that? Socially active, groups like here, meeting people, talking, discussing, mushara, whatever you do, anything to stimulate your mind. Reading books, learning a new language. In fact, people who are bilingual have 4 times less risk of getting dementia. Learning Quran, a new ayah once a day, it stimulates your brain. Starting a new hobby. I learned how to boil an egg and fry an egg. Finally, without. So I was spoiled.
Is that a hobby or necessity now?
It's getting to be a hobby. I'm starting to enjoy it. And partly it is because Meena is too busy. When I needed her, she's getting busy with her life.
She gets over your back.
You are doctor.
Huh?
You are the doctor.
No, once you get into it, it is kind of enjoyable to enjoy the food you have made, and learn from your mistakes. You know what you've done wrong. Gardening is another good thing, especially in the summers. It's very helpful. Playing games, challenging games, anything you like, stimulating through the brain, chess, whatever. Any of the online games you do, yes, it's fun to do it, but remember, after a while, morning, but after a while, I have to think about doing something else because you need to develop different circuits to keep stimulated. Going for a walk, particularly in a park, without your phone. Because if you're doing a phone or talking to your friends, no. You want to enjoy the walk, enjoy the scenery, enjoy the birds singing, the fragrance of the flowers, listen to the water in the stream next.
Wow.
So there's so much stimulation. I just love to go to North Knoll, walking in there. It's so much stimulation of all your senses, and it has been found, particularly going in the forest, in nature, is really good for your health. Again, without a phone. It's a waste of time if you're on the phone and walking. No.
Yes, no, good one. Refresh.
And stimulate the release of feel-good hormones. I talked about, dopamine and endorphins and things like that. So I mentioned exercise, sleep. Those are all release the feel-good hormones. Other things you can do, meditation. And I never believed in yoga, but it does seem to make a difference. You relax your mind and concentrate. It does release the endorphins and you feel better. Listening to your favorite music, but again, in moderation, not all day, all night, okay? And that makes you feel good. That's good. Exposure to sunlight is very helpful, not only for vitamin D, but it makes you feel good. Okay, just relax in the sun. Not even have to do anything. It makes you feel good. Mina has cats. She always had cats. To me, they were a pain, but lately I've found out there are a lot of, they make you feel good. And nowadays it's easy to take care of them. They have those automatic litter cleaning things, so you don't even have to worry about that. So that's good. And tending to your spirituality, reading Quran, concentrating, learning, meditating about it. If you're enjoying it, the more you do it, you'll enjoy it more, and that's good for your brain. Tending to your spirituality. So the principles last slide of neuroplasticity, you use it or you lose it. You have to keep doing it. And use it and improve it. You have to keep working at it and improve on it. Repeating it. Once you start something new, you have to keep repetition to reinforce, to set in the circuits. And the intensity matters, how much you concentrate on Alzheimer's, vascular disease. So all those diseases cause dementia. So dementia per se is not a diagnosis. Dementia is a group of symptoms caused by those diseases.
Okay.
Can it be reversed?
Can it be reversed?
I mean,
if you implement all the recommended things early in life, earlier, and with consistency and intensity, that you prevent the synapses from going away, then in fact, the one study I mentioned first on that with earlier intervention in the 50s and appropriate, not that intervention, you do it one day and forget about it, consistently, there was almost a 50% reduction in the risk. But it has to be started early and followed consistently. By the time you get to be 70s, 80s, and you have significant dementia, unfortunately. You may slow the decline, but you cannot reverse it completely.
What is a brain fog? Brain fog, what is that?
Brain fog is one of the symptoms where, I mentioned the brain is not as sharp, and you don't remember the things as clearly as you want to. Everything is
Confusion.
confused.
But brain fog necessarily dementia से जरूरी नहीं है.
It is not a must. You can get it from other reasons too.
नींद ना हो या कोई हो तो focus नहीं होता है.
That's right. If
It's
you're not
not
sleep,
relate with dementia.
it is related to dementia also, but it can be, as you said, related to other things too. Yeah.
Like अगर मैं रात को ठीक से नहीं सोई, and if I have to do some work, it's very difficult for me to focus.
And well, what I mentioned, you're not getting enough sleep. You're not clearing the waste products, so you're getting foggy, groggy in the morning. You're out of it. You're not sharp.
Also, my father-in-law, he has dementia, and we are very particular. He sleeps on time and wakes up on time. Because any day, if he's late to sleep or he does not sleep, we know the next day is going to be
And
difficult.
it's very confusing.
It's
Yeah,
so
they have to have a very regular time schedule, and also the place. If you go to a different
He
place,
changes place that he's up.
and a lot of confusion, they get lost.
Yeah.
So,
Yeah.
so they adjust it to time and place. So any change will mess that up.
We're very careful that we don't give him chai after 2 or anything. Because
Yes,
he sleeps
yeah.
at 7.
Yeah.
And we want him to sleep at 7.
What foods we should avoid to prevent it? What food? Diet
Avoid. What foods to avoid?
to prevent from dementia.
Unhealthy food.
Other than the things that I
Sugars.
mentioned, Mediterranean diet, other than that, you should minimize. I cannot say you avoid completely, One has to be, take the recommended diet. Other things you can, chawal once in a while.
No, I heard that popcorns are very harmful for this.
I cannot talk about specific, I don't know, I haven't heard that, actually.
I have heard in the Sam
Actually.
Walter's
Actually. I didn't hear
speaking.
that. Any processed food, is
Yeah,
not
processed food,
good. It's not
mainly
good.
processed
It's
foods.
very bad.
How come dairy does not figure in the diet recommendations for
Dairy, the only thing is cheese.
दूध नहीं
Cheese.
लेते,
दूध नहीं.
glass of
Even
milk.
दूध में there's only protein. There's calcium, but other than that, there's some lactose, some sugar. But other than that, there's nothing specific in there.
You have mentioned
Dahi
the
is
balanced
good.
diet.
Dahi is good in the sense it promotes the development of the good bacteria in the gut.
Yeah.
But it has to be,
Greek yogurt.
the natural kind, not the artificial, where there's no bacteria in that.
Last question for me. Is it genetic?
What is it?
Dementia, is it genetic?
Actually, genetic. I didn't touch on the genetic aspects of it. That's a huge subject by itself. But there are 3 kinds of genes that affect the risk of dementia. There are certain kinds that actually decrease the risk. There are certain kinds that increase the risk, and there's one kind that is familiar. You have in the family, everybody gets it. Yes, there's a genetic component to everything. Okay, but in dementia, the one that is inherited, fortunately, is a low risk. But if they have that in that family, the people tend to get it in the 40s, very younger ages. Yes, sir. Chief.
Suppose, just like as a human being, we are facing a lot of different problems, medical problems, with a physical problem, and then just like if you go to the orthopedic doctor, they will, do the surgery or anything, and then they refer to you the physiotherapist like me, and then that way they get more cure and ideas. Same way we want to concern about the dementia, what kind of doctor or what kind of caregiver, medical caregiver we can go to so that they can help us, just like the physical therapy or any other thing for other profession has it.
What kind of doctors?
what kind of profession help you? Just like, you have if you have the bone problem, you go to the bone and then followed
Yeah.
by
So,
the.
नहीं कह रहे कि dementia का अगर problem तो कहाँ है?
There are
Did you go
some
to you or what?
there are some neurologists that focus on dementia. There's some psychiatrists that focus on dementia. So you'll have to find out from there. Some internists also do it, but mostly it's neurologists and psychiatrists that take care of it. But geriatrics is lately a newer field where they're starting to take care of older patients with these kinds of problems. So I would start off with a neurologist and go from there. Yeah. They are well, it depends. Some are more interested in that, and some are not. Neurology is on the brain disorders, but psychiatrists also do quite a bit of that, and geriatrics also, they are, diseases of the older people.
Thank you, Dr.
Thank you very much.
Thank you very much for your time.
Sure.
So that he should give the paper.
Yeah.
Before I forget,
Then, inshallah, we may invite you for some other topic here soon. We may invite, inshallah.
but I wanted to show off.
ये कह रहे थे ना,
I'm
कुछ
gonna
देना
show off.
है